I'm going to be your student nurse today. Can I look at your bracelet for just a second? What's your name?
I'm Katie.
And your date of birth?
1/17/95.
Good. So we're going to be doing your physical assessment. Is that okay with you? Okay, and the tech has already done your vital signs, so we can just go ahead and get started. I'm going to start by inspecting your head and your scalp, and I'm just looking for any visible depressions or lesions or abnormalities, and I don't see any. The next thing I'm going to do is palpate your sinuses, and you just let me know if there's any tenderness. We're going to start with your frontal sinus, any tenderness, and your maxillary sinuses, any tenderness. Okay. Now we're going to move down to your eyes, so just look at me for just a second, and your eyes are symmetric with your face, and your eyebrows are symmetric with your face, so that's good. I'm also going to check your conjunctiva, so I'm going to pull down and you look up, and those are pink and moist, and your sclera, and those are white and moist. I'm also going to check to see how your eyes accommodate, so can you follow the pin with your eyes? I'm also going to check to see how your eyes react to light, so look just straight ahead. Good. Good. So your pupils are round and equal, your eyes accommodate, and your eyes react to light. Now I'm going to move down to your nose, and your nose is symmetric with your face, and can you flare your nostrils for me? Good. I'm also going to check the patency, so can you sniff for me? And again. Good. I'm also going to check your mucous membrane, so can I have you lean your head back a little bit? And those are pink and moist. And I'm also checking for a deviated septum, and you don't have one, so that's good. Now we're going to move down to your ears, or over to your ears. And I'm just going to palpate the external ear, and I'm just checking for any abnormalities. Just let me know if there's any tenderness. There's none. Good. I'm also going to check your internal ear, and I'm just checking for any drainage. And I don't see any, so that's good. Now I'm going to move down to your mouth, so can you open your mouth for me? And raise up your tongue and move it side to side. Good. So your lips are pink and moist, your tongue is pink and moist, your teeth are white and straight, your gums are pink and moist with no white spots, your cheeks are pink and moist, and your uvula and your tonsils are intact and midline with your throat. Next thing I'm going to do, I'm going to move down to your throat. So can you raise your head up for me a little bit? And I'm just looking, inspecting your trachea to make sure that it's straight and midline with your throat, and it is. I'm also checking around your thyroid to see if I see any visible masses or enlargements, and I don't see any, so we're good there. Now I'm going to osculate your core cord, and I'm just listening for any brueries. Good. I didn't hear any brueries, but if I did, that would indicate a stenosis or an occlusion, which is a narrowing of the vessels or a blockage. Now we're going to move down to your anterior thorax. And I'm just inspecting, and I'm making sure that the skin color is consistent with the rest of your body. I'm also checking the temperature and to make sure there's no moisture, and there's not. Can you take a deep breath for me? Good. And your lungs expand symmetrically. I don't see any visible palpations. And I don't see any use of your accessory muscles when you breathe. Now I'm going to osculate your anterior lung sounds. So just breathe for me. Your lungs sound clear. I didn't hear any adventitious noises or wheezing or ronchi or anything like that, so it's good. Now I'm going to go over your monthly breast exam. Do you give yourself monthly breast exams? Okay. Well, it's recommended that you do, especially if breast cancer runs through your family, and that you need to do it once a month. And normally people pick the first of the month because it's easier to remember. But I'm going to go step by step with you how to do it. Just do what I do. So raise up your arm and put it behind your head. And you're going to take your other hand and start in the auxiliary region, and you're going to feel for any lumps or anything that you normally wouldn't feel, and you're going to make circular motions around your breast until you get to the nipple, and then you're going to squeeze. And if at any time you feel any lumps or you have any discharge, you need to contact your healthcare provider as soon as you can. And you can also do that in the shower or lying down, whichever one you prefer. Now I'm going to move to your posterior thorax, and I'm going to inspect your spinal column. And I'm making sure that it's straight and in line with your body, and it is. I don't see any kyphosis or scoliosis, so that's good. I'm also inspecting the skin color and making sure that it's consistent with the rest of your body, and it is. I'm also checking the temperature and to make sure there's no moisture, and there's not. Can you take a deep breath for me? Good. And your posterior lungs expand symmetrically. Now I'm going to osculate your lung sounds. So just breathe for me. Okay. And you would do about 10 places on the posterior thorax. Now I'm going to move to your lateral thorax. I'm going to osculate there as well. Good. And all your lungs sounds are clear. I didn't hear any adposition sounds or rhonchi or wheezing in your posterior or your lateral. The next thing I'm going to do is osculate your heart valve sounds. And your heart is located between the second and fifth intercostal space. Just right of your sternum in the second intercostal space is your aortic valve. Just left of your sternum in the second intercostal space is your pulmonic valve. And your third intercostal space is Erb's point. Right below that in the fourth intercostal space is your tricuspid valve. And then the fifth intercostal space is your mitral valve. Also while I'm down here, I'm going to check your apical pulse. And it's located in the fifth intercostal space, midline to your clavicle. And I didn't hear any murmurs or dysrhythmias, so that's good. It all sounds good. Now we're going to inspect your upper extremities. And I'm just checking the skin color to make sure that it's consistent with the rest of your body, and it is. I'm also checking the temperature and to make sure there's no moisture, and there's not. I'm also going to check your skin turgor. And there's no tinting, so your skin is good and elastic. I'm also going to check your capillary refill, and that blanches within 3 seconds, so that's good. And I don't see any clubbing. Now I'm going to check your pulses. I'm going to check your brachial pulse, and those are bilaterally symmetric, and your radial pulse, and those are bilaterally symmetric. I'm also going to do your range of motion, so just do as I do, and raise your arms up, and out, and above your head, and behind. Good. I'm also going to check the strength of your joints. So I'm going to get you to push towards me. Good. And pull away from me. Good. Now, go out and in. Good. The next thing I'm going to do, I'm going to listen to your, or inspect your abdomen, so can you lay down for me? Good. And I'm just inspecting your abdomen, so hold your breath. And I'm just making sure that your stomach is flat and smooth, and that there are no visible enlargements or masses, and I don't see any, so you can breathe. Now I'm going to osculate your bowel sounds, and it can take up to 5 minutes to hear a bowel sound in each quadrant. So lower right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Your bowel sounds weren't rushed or loud, and I heard them in every quadrant. So they weren't hyperactive, and they weren't absent, but they weren't hypoactive, so they were normal. Now I'm going to palpate each quadrant. And I'm feeling around, especially around the muscles, around the organs, like the liver and the spleen, and around the kidneys. And I didn't feel any masses or enlargements, so that's good. Now we're going to move down to your lower extremities. And I'm just inspecting the skin and for I'm checking the temperature. I'm also checking to see if there's any moisture, and I'm also checking your skin color to make sure that it's consistent with the rest of your body. I'm also going to check your pulses. I'm going to start with your femoral pulse, and those are bilaterally symmetric. Your popliteal pulses, and those are bilaterally symmetric. Your posterior tibialis, and those are bilaterally symmetric. And your dorsalis pedis, and those are bilaterally symmetric. I'm also going to check your capillary refill, and they blanch within 3 seconds, so that's good. I'm also going to do your range of motion. So I'm going to raise up your leg and bend it. So flexion, extension, abduction, adduction. And that's good. Alrighty, have you set up for me? I'm going to check the strength of your joints. So can I get you to kick out for me? Good. And move them in and out. Good. Alrighty, we're all finished. Do you have any questions for me? Alright, everything was good. There was nothing abnormal, so we're all good. You're good to go. You can put your shoes on and get out of here.